Hi, I'm Tom with Smart Strength. If you're looking for ways to fix your shoulder pain, then you're in the right place. In this video, my good friend Ashley and I are going to look at the role that mobility plays in causing and correcting shoulder pain. After we toast a drink, we're going to take a look at the anatomy of the shoulder and the surrounding structures. I need you to hang in there with us through that anatomy because we're going to be getting to some really exciting topics, like why our way of living tends to cause shoulder pain, are standing desks helpful, and what are the best ways to improve mobility to help deal with shoulder pain. If you like what you see, go ahead and subscribe and leave me a comment. Let me know what your favorite part of the video is. Hey everyone, thanks for joining us. We have an exciting three-part series that we're doing on shoulder pain. I have Ashley Taylor here, and we're going to be looking at how to address shoulder pain by improving mobility, stability, and strength. Today we're going to be looking at the mobility part of shoulder pain. So we'll start things off with a drink. Cheers!
Cheers!
Always love a good Moscow Mule. What do you think about this?
The best thing about mules, to me, are that you can drink them year-round. It's like light, refreshing, can pair with anything or nothing at all.
Do you have a preference on type of vodka?
My go-to would have to be Tito's, which is probably like mid-range. So I vote Tito's.
If anyone watching this has a preference on types of vodka for mixing, please leave us a comment. I need some suggestions. I'd appreciate that. I love the Moscow Mule. I think it's a great standby. It's an awesome one to have in the rotation. I highly recommend it. It's very tasty.
Yes, indeed.
Okay, so here's our overview of the shoulder joint. We're first going to talk about the anatomy of it, and we're going to talk about shoulder issues and why they are so common. And then once we've kind of laid that groundwork, I think we'll be able to actually talk about shoulder pain and why mobility is important for that. Ashley, give us an overview of the anatomy of the shoulder joint.
So one of my favorite analogies when talking about the shoulder in regards to the anatomy is the golf ball on a golf tee. The golf tee would resemble the joint, the socket, the glenohumeral socket, and the ball would be the humerus. So it's about a 4 times difference of size for the head of the humerus on the glenoid where it rests. So that's why the shoulder has so much mobility, and it requires a ton of extra support from the surrounding structures for its stability. Around that shoulder joint, you have the joint capsule, which is made up of a bunch of different ligaments. In addition to the ligaments, you have the rotator cuff muscles, which are 4 super important muscles that help stabilize the head of the humerus into that socket. And so it can kind of prevent some extra movement when you're going through different positions, for example, overhead reaching or throwing motions. That rotator cuff provides a lot of stability to the shoulder joint. And I have a couple of pictures to kind of enhance the description. So the first image that we have is just going over the joints. You have your glenohumeral joint, which is what I was referring to, the golf ball and golf tee. You also have your AC joint, which is where the acromion and the clavicle come together. And then you have your SC joint, which is where your sternum connects to your clavicle. And then in the back, you have the scapular thoracic joint, which is what we'll be talking about a little bit later in regards to mobility. The next picture shows you a little bit of a cut view of the ligaments and then also the rotator cuff muscles. And then the next image also shows more in depth of the rotator cuff muscles. And then the final image just shows you that everything on top are the deltoids, the pecs, the lats, and some of the muscles on the mid-back. So there's a lot going on in the shoulder girdle, which allows for a lot of mobility with a big demand on strength and stability. The thoracic spine, your mid-back, is connected to your shoulder through the scapula, through your shoulder blade. And I have another image here that shows a little bit of the anatomy of the thoracic spine. So you can see where the muscles that attach from your mid-back connect right to that inner border of the shoulder blade. So if those muscles are weak or not moving properly or stiff, then that's going to really have an impact on your shoulder and your thoracic spine. Concurrently, if your thoracic spine is stiff and not moving well, it's going to place more demands on those muscles. So your thoracic spine is also connected to your ribs and is vital to protecting our organs. So there's not a ton of movement in bending forward and backwards, so moving into flexion or extension in the thoracic spine. But you do have a lot of available range of motion to move into rotation. The greatest amount of rotation will occur kind of in the mid levels. So in the thoracic spine, there's 12 vertebrae, and the most rotation occurs in numbers 5 through 8. That's typically where we want to work on mobility, and we can see a lot of the stiffness occur.
So anatomically, your T-spine 5 through 8, like where are they located? If you reach behind your back and try to feel them, are they like even with the bottom of your scapula, or where exactly?
Typically what we use as a gauge for finding T7 is the very bottom point of the shoulder blade. And so you can go like a little bit above and, just maybe an inch below that, and you would have your 5 through 8. So you'd have to have really good mobility to be able to reach up in between your shoulder blades and feel where those segments are.
Yeah. With regards to mobility, why are shoulder issues so common?
Like I was saying, the shoulder is super, super mobile. And so the shoulder joint itself is really mobile just because of the way that the joint is designed. If you have a lot of mobility and not sufficient strength from the surrounding musculature, you're at risk for shoulder dislocations, you're at risk for kind of more hypermobility injuries. On the opposite side, if you have a lack of mobility and stiffness in that joint or the surrounding musculature, then it places demands on other parts of the body to be able to move more. So if your shoulder's, stiff or tight and you can't, reach up and grab something, or you can't, get into that proper throwing position, then the movement is going to have to come from somewhere. And that could be, the thoracic spine, it could be the neck, it could be the elbow, the wrist. So anything kind of right next door to where that shoulder is, the shoulder's not moving well, the movement has to come from somewhere.
The average everyday person, why are they predisposed to having poor mobility at the shoulder joint and the surrounding structures that we've been talking about?
So typically, unless everyone in America has had jobs like you and I do, or we're very active, most of America is spending time sitting at a computer, sitting at a desk, and sitting is not ideal for our bodies. Our bodies were created to move, and it demands movement. And so if you have to work 8 hours at a desk, granted now most people are working from home, but some people are still having to commute. So you're thinking about, you're sitting in a car, driving, commuting to work, which in this area can be forever. And you get to work, you're sitting at your desk, and then you have to commute home. When you get home, you're probably going to sit and eat your dinner and then sit and watch TV to unwind for the day. Hopefully within that, that 10 to 12 hour day, you're getting in some type of exercise. But most of the day we spend sitting, and that sitting posture can really bring us down to gravity. So our shoulders kind of round forward, our necks poke forward. We might rest our chin on our hand as we get more and more tired throughout the day. And that's just creating a more flexed position of the thoracic spine. And when there's not a ton of movement into flexion or extension and you're sitting in, kind of a one position for a long time, it's just going to get stiff. And so our bodies, being designed and created to move, need to move. And there's no one perfect posture, because even if you sat in the most, anatomically advantageous position, within a couple minutes or so, your body's going to be naturally wanting to shift to one side or change positions. But ideally, you want to move. You want to be able to change positions. You want to find a good posture, one that's not kind of falling to gravity, but recognizing that there is not one perfect position that you're going to stay in, for your 8-hour workday either. So I always say movement is medicine and motion is lotion. So if you can get movement in throughout the workday, you're going to save yourself a lot of stiffness and discomfort in the mid back, and then also in the shoulders too.
If you made it this far, things are about to get fun. Up next, we are talking about which thoracic spine movement is most important for proper shoulder function. Also, should you focus on active or passive range of motion? And finally, why is scapular mobility important for shoulder health? Okay, so with your thoracic spine, there's a lot of movements that the T-spine can do. It can do flexion and extension. It can do what's called lateral flexion, so you're flexing to each side, and then it can also do rotation. So which of these movements is most important for proper shoulder function?
Well, I would say all of them, but when you're talking about available movement and what's most important, the thoracic spine can do the most rotation. Flexion and extension is mostly limited, just the way that the vertebrae are designed, but you need to have sufficient extension in your thoracic spine to be able to get into a completely upright position, which if you're reaching up overhead, you need to be in a completely upright position. So if you have a lack of thoracic extension, or if you're stiff getting there into that upright position to reach up, then when you reach up, you're going to have to reach further with the shoulder than you would if you had really good range of motion. And same thing with rotation. If I'm trying to, reach across to grab the seatbelt, let's say, and I'm trying to reach across, I'm rotating through my thoracic spine. Yeah, I'm moving elsewhere, but I'm reaching across. And if I don't have that rotation, then I have to reach across even further with my shoulder than I would if I had enough rotation. Another example that we all do every day is use the commode. And if you're having to reach back, you need to have sufficient rotation to be able to get your arm back. Otherwise, you're just going to be reaching backwards into internal rotation of that shoulder, which can lead to issues as well. So I would say extension and rotation probably more important than flexion and lateral flexion.
A lot of the athletes that I work with, if they have shoulder problems, it's typically doing overhead movements, pressing or explosively, doing jerks overhead. If somebody has a lack of mobility, I guess particularly in the thoracic spine, why do you feel like they would feel pain in that type of movement?
So the thoracic spine is like the stiffest area in the entire spine. So you have the stiffest area in the spine partnered with one of the most mobile joints in the body. So if there's a lack of mobility in the thoracic spine, even more so than there already is inherently to its anatomy, then the shoulder is going to have to take the brunt of that mobility. So when you're reaching up overhead or trying to get into a position where you're doing, a jerk, you're going into what would be considered thoracic extension. So your back is going to be straight or upright versus, hunched forward. And so if you have stiffness in the thoracic spine and you can't get to that completely upright posture, then the shoulders are going to have to move further back than they would normally need to. Again, if you don't have the mobility in the shoulders or the thoracic spine, then you're really putting yourself at risk for injury.
With improving the mobility of the thoracic spine, there's a lot of different exercises that you could choose to do. One of the big things that I wanted to get your opinion on was active versus passive range of motion. Could you talk a little bit about like what are the differences between active and passive range of motion, and which one do you think might be better for improving T-spine mobility?
All right, yeah. So active range of motion is the amount of range of motion that you can get to while you're actively moving. Passive is the true amount of range of motion that's available at that joint or muscle. So if we're talking about the thoracic spine, so it's the true amount of movement that is available within those joint segments and within the flexibility of those muscles. The easiest way to work on range of motion as a physical therapist, I would be working on improving someone's passive range of motion. So if they're really stiff, I could work on doing some joint mobilizations or manipulations through that thoracic spine to try to free up movement within those joint segments, and or passive stretching of the muscles in that area if they were tight. But for folks at home or on their own, they can work on improving their active range of motion by, like you mentioned, exercises and different stretches.
This is kind of anecdotal, but I personally have seen a lot of improvements in my own thoracic mobility by doing active rotation exercises. So instead of just stretching into a position, actually forcing myself, using my own musculature, my own ability to twist, if we're talking about rotation, to twist into a certain position, and even against potentially band resistance or something like that. So I found a ton of benefit to not only being able to get into a position, but then to be able to get yourself into that position, I've found to be hugely beneficial.
Yeah, and working into active range of motion is going to actually train your muscles to be able to use that available range of motion. So as you're actively moving, those muscles are having to work through that range of motion. So as you continue to, increase and increase, then your muscles are going to get stronger through a wider range of motion, which is great.
Yeah, and how many everyday activities do you just do passively? Like how many things in everyday life do you just do passively? I think that if you want something to carry over to everyday life or to sports or activities, I think that having that ability to get into that position is hugely essential.
Mm-hmm. Yes, 100%.
So we've just talked about the mobility of the thoracic spine, why that's important for shoulder health. Let's talk a little bit about scapular mobility. So the ability for the scapula to move. There's a lot of different movements that can happen at the scapula. So if we talk about a lot of everyday activities, like anything that requires going overhead. So it can be an exercise where you're pressing overhead, or it can be reaching upwards for something that requires the ability for the scapula to what we call upward rotate, to provide that range of motion. In addition to that upward rotation, let's take a movement like the front squat. So you have the bar on the front of your shoulders and you're doing a squat. It's a common movement. I highly recommend it if you're not doing it. In order to get into a good, what we call front rack position, your shoulder blades have to protract. So they have to actually move away from each other, kind of around the rib cage, to allow you to get your elbows high, to rest that bar on your shoulders. It's the same thing with a more dynamic movement like the clean, where you have to catch that bar with your torso as upright as you can. What I've personally seen training folks and training athletes is that those that aren't able to get their shoulder blades protracted then are doing those movements in a position where they're more bent over and their torso is angled more forward, putting more stress at the thoracic spine and potentially, putting that T-spine into flexion. I guess my question is, do you have any thoughts on those types of movements and how the mobility of the scapula plays into that?
Yeah, so those specific movements would require a lot of mobility at the scapula. And the scapula, like you said, it can do upward rotation and then opposite downward rotation. It can do protraction moving away, and then opposite retraction. It can also, there's a little angle of anterior and posterior tilt, and then a little bit of internal and external rotation with the shoulder in those movements. So having enough mobility to get into that position would be really important, because if not only are you going to get flexion into the T-spine, but you're also going to get too much rotation in the shoulder, which could also lead to shoulder pain, as well as a thoracic spine pain or stiffness, or potentially injury as well. So being able to have sufficient mobility is really important in those movements with your athletes that you're training. And just as well as, like you said, if you're reaching up into a cabinet, you got to have enough upward rotation and a little bit of protraction and tilt to be able to sufficiently get that shoulder up there. It works together, the shoulder blade with the glenohumeral joint. If you're reaching down to tie your shoe, your shoulder has to kind of do a little bit of downward rotation and depression to try to get down to reach that shoe. So in athletics as well as everyday life, that shoulder blade needs to move freely. Otherwise, you're going to, just like if there isn't enough mobility in the thoracic spine, you're going to place demands of mobility at the other surrounding joints.
Don't go anywhere. Up next, we will answer the question, is posture the main reason that people deal with shoulder pain? Also, are standing desks helpful at all in improving shoulder pain? And finally, which technique cue is essential when doing thoracic spine mobility exercises? We talked mostly in the intro about kind of this chronic issue of how people are spending their time sitting, potentially hunched over, potentially not moving. And I wanted to ask you, in your opinion, is the issue that people are sitting in a position with a flexed thoracic spine, like is that the cause of more shoulder pain and discomfort? Or do you think it's that people aren't moving enough and you need to actually move your spine into different positions, or maybe it's a combination of both?
Yeah, I definitely think it's a combination of both. I think, like I mentioned earlier, there's no one perfect posture. So even if your desk was ergonomically set up where your monitor's at the right height, your keyboard's at the right level, your armrests are perfect, your lumbar support in your chair, even with all of that being perfect, your body is still designed to move. So movement is medicine. If you're not moving throughout the day, you're going to start noticing more aches and pains. And if you're not moving through your full available range of motion, you're going to get stiffer and stiffer and stiffer. And so working on that mobility is so important. Just doing little posture corrections during the day. I mean, that's enough movement. It's not like something you have to commit to. Oh, I need to do 10 minutes of exercise every hour. It's just getting your body to move through the motion that it has.
Yeah. Since I've been working from home a lot more, I have made a standing desk for myself. And I found that when I stand, maybe it's not just the actual act of standing, but it's the fact that I'm kind of constantly moving, like shifting my weight back and forth and moving around. I found it to be excellent for how my T-spine, thoracic spine, and shoulders feel.
Yes, definitely. I think there's, like, in the last even 10 years ago, I would say there's been a huge shift towards desks that have the ability to move from a sitting desk to a standing desk, or folks just have a pure standing desk because our bodies are made to move. We need to change positions. And I think if you're sitting, you subconsciously will move whether you're paying attention to it or not, just as if you're standing. So being in one position for a prolonged period of time is not good for our bodies.
What would you say are your favorite exercises or favorite ways to improve the mobility of the thoracic spine? What are your go-tos?
Oh, there's so many good ones and they all feel so good. But I would say I probably favor an exercise that I call open books. You can do that with or without a foam roller, same as one that I would call thread the needle, which is a fun one. And then another one of my favorites is quadruped active thoracic rotation. So that's one where we're talking about you're moving actively using your muscles to try to get through as much rotation in that thoracic spine as possible.
Yeah. Some of my favorite ones involve using a foam roller as well.
Mm-hmm.
So there's one that I do that I call it Snow Angels, where you're laying on your back with a 3-foot foam roller and sweeping your arms through. And then also another similar movement, I call it scap slides, also laying on a foam roller, I think is a really good one. During both of those movements, I focus on flattening out my lower back into the foam roller first, which I've found to be really effective in me feeling that movement in the thoracic spine. It's because you're almost like neutralizing your lumbar, your lower vertebrae.
Yeah. And by doing that, also you're kind of engaging your core, because when you're lying on the foam roller, if you don't have your core engaged, and you start moving your arms to try to work on your mobility, the shoulder and thoracic spine, you're going to be kind of wobbling all over the place. So that's a really good and important part of those exercises for sure.
Yeah, because if you don't do that, then you're just, that range of motion, this whole problem we're talking about is that range of motion is coming from putting more stress on your lower back or on your shoulder joint, right? And we're trying to address the main issue here, which is the thoracic spine. So another movement that I really like is resisted thoracic rotation, particularly with band resistance. I've found that one really helps. I've seen a lot of benefits from doing that movement as well.
Yeah, that's a good one too, because you're not only working on your active thoracic rotation, but you're engaging all of those scapular muscles and the muscles that stabilize that shoulder blade onto the trunk. So you're working on your middle trap, your rhomboids, all of those muscles that we showed in that image of the thoracic spine, while actively improving your mobility in the thoracic spine. So again, more bang for your buck out of one exercise.
In this final segment here, we're going to be looking at what is the best exercise to improve scapular mobility. Also, can stretching help with shoulder pain? And finally, are breathing exercises valuable for improving thoracic mobility? So what are your favorite ways to improve scapular mobility? So if someone's struggling with some of these movements we've been mentioning, they're having shoulder pain, what would be your go-tos for improving scapular mobility?
Well, I'm biased because I'm a manual physical therapist, so I like to use my hands to work on people. So if I had a patient in the clinic or, in my house or in their house, I would probably do some type of manual therapy to work on getting that shoulder blade moving, in all the directions that it would need to move properly, freely, and with, little to no pain as it was moving through there. Granted, not everybody's in my house, in their house with me, or in a clinic. So there's a lot of different things that you can do actively, just like you can work on your thoracic range of motion and mobility actively, you can actively work on your scapular mobility. And there's a lot of different stretches and exercises. One that people might be familiar with is, active shoulders. And you can do this with a dowel. You can do it with a lat pull down bar. Even more progressed, you can do it hanging from a pull-up bar, where you're essentially just going through controlled movements of the shoulder blade. So you're going through elevation, depression, you can go through protraction, retraction while holding the bar up overhead, and kind of working on those different movements will hit the other movements as well.
I'm a big fan of an exercise like I call it the scap push-up. And maybe you could define this as a strengthening exercise rather than mobility. I think it fits into the mobility. The scap push-up is something that I really like, and that I have a lot of the people that I train do that movement. I do it myself.
Yeah, that's a great exercise, and you can do it. I'll have patients do it just starting lying on the table, doing an active, what I call like a serratus punch, because you're activating the serratus anterior, which is one of the muscles that does, the main muscle that does shoulder protraction. So you're taking them in that kind of like imaginary push-up position, reversing it, and doing that same motion, and then progressing them to doing a wall scapular push-up, and then, you know, eventually getting them on, you know, all fours, and then working into a kneeling and a regular push-up is a great progression. And that's a really, really great exercise to utilize. And I think when you talk about it's technically strengthening, active range of motion, you're working through active range of motion. So you're using your body's resistance. So technically you are working against resistance, and it is strengthening, but it's also mobility. So it's kind of a you know, two birds, one stone that you're getting in one exercise.
Yeah, and I think that as we go through this series where we talk about mobility and stability and strength, I think we're gonna be coming across a lot of situations where it's like, well, this checks 2 of those 3 boxes, or maybe even all 3 of those boxes, and it's because none of these things exist in a vacuum. Like, your body requires all 3 of these elements to work often in harmony with each other to be a functionally moving individual.
Yeah, and I say if it checks 2 or 3 of the boxes, then that exercise is giving you a lot of bang for your buck, which means you have less number of exercises to do.
That's a good point. It's all about efficiency. I wanted to ask you, what about static stretching? Could you pick like a number 1 or number 2 type of stretch to recommend to someone who has shoulder pain?
So I would say definitely I would trend towards pecs, like a doorway stretch, and the corner stretch would stretch out everything anteriorly that gets tight from prolonged sitting in this kind of forward slouched position. So the shoulders get more forward rounded, the thoracic spine is flexed. So standing in a corner in a stride step, you know, leaning slightly, keeping your head up, keeps that thoracic spine extended, but stretches and opens everything up in the anterior part of the shoulder. And the doorway stretch you can do in a variety of different positions to work on the different angles of the, you know, the pec muscles that kind of attach in the front. So I would say probably those 2 are my go-to shoulder stretches. And then I might even throw in a towel stretch for internal rotation, because a lot of times folks have a lack of internal rotation, which is a really functional movement. Like we were talking about earlier, reaching behind when you're sitting on the toilet, or, you know, for ladies, reaching behind our back, or for tucking in your shirt or getting your wallet out of your back pocket, you have to have sufficient internal rotation. So just doing a simple towel stretch to work on that internal rotation would be another one of my more go-to static stretches.
Okay, and then there's something that I read recently that I wanted to ask you about, and it had to do with actually the effect of breathing, like practiced breathing exercises on thoracic spine mobility. The rationale was basically that breathing is like stretching from the inside out. What are your thoughts on breathing exercises? Do you think there could be value to that actually helping improve shoulder pain?
Yeah, 100%. And I think coming at it from the approach that you're stretching from the inside out, you're working on expanding the rib cage by moving the diaphragm. So if you're doing diaphragmatic breathing versus, you know, breathing from your chest, you're going to get a bigger bang for your buck at expanding the rib cage and getting movement through the thoracic spine through the ribs, which improving the thoracic spine, we know, the mobility of the thoracic spine, we know will impact the demands placed on the shoulder. And not only is breathing good for increasing mobility and kind of stretching, but also it's great for stress relief and mindfulness, which is huge in relieving chronic pain. Not only does diaphragmatic breathing work on helping kind of open up the rib cage, improve thoracic mobility, but it'll also reduce your stress and just make life so much better by just simply practicing breathing, even if it's 2 to 5 minutes at the end of the day when you're in bed. You can do it as simple as that, or you can tie in breathing with any of the active mobility exercises and kind of working through your breath as you're increasing that stretch actively.
Yeah, and if you haven't tried breathing exercises, I recommend give it a shot. Just take a massive breath, hold it for 10 seconds, 15 seconds. Just fill your lungs with air and do that a few times and see how that makes you feel. I've found it to be really helpful for me.
For sure. And then grab yourself a Moscow Mule, take a couple extra breaths, kick back and relax, and you'll feel even better.
Yes, stress relief 101. So there you have it. We have mobility and how that can help improve shoulder pain. Ashley, thank you so much for joining me for this. We still have 2 more segments to go. I'm really looking forward to talking about strength and stability as well. I hope that you found this useful, the viewer, and helpful for you. And I hope that you found some ways that you can help improve your own mobility, thoracic spine, scapular, and how that can help improve your shoulder pain. So, Ashley, thanks so much.
Thanks for having me, Tom. It was great collaborating with you on mobility and hoping that we can help people get moving better, have less pain, and be able to get into the positions that they need to be into to do the things that they love. And I'm looking forward to our next segments and can't wait to chat more.
Awesome. If you like this video, go ahead and hit the thumbs up button. Also hit subscribe, and it just lets me know that you want to see more of this type of content. So thanks for watching.